Okay, ladies, let's go ahead and get started. Everybody needs to turn their book to page 316. So we're going to be going over chapter 10, minor office surgery this morning. All right. So let's see here. Alicia, go ahead and read Introduction to Minor Office Surgery, please.
The term surgery is defined as the branch of medicine that deals with operative and manual procedures for correction of deformities and defects, repair of injuries, and diagnosis and treatment of certain diseases. Minor office surgery, also known as minor surgery, refers to a surgical procedure that is restricted to the management of minor conditions and injuries that do not require the use of general anesthesia. Minor surgical procedures have the following characteristics: are performed in an ambulatory health care facility, such as a physician's office or clinic, can be performed in a short period of time, usually in less than an hour, require a local anesthetic, a topical anesthetic, or no anesthetic, can be performed safely with a minimum of discomfort to the patient, do not under any circumstances pose a major risk to life or to the function of an organ or body part. You want me to keep going?
No, that's okay. Go ahead and stop.
I can keep
Okay.
going if you want.
No, that's okay. That's all right.
Okay.
Okay, so I want you ladies to go and highlight the word surgery. And where it says minor office surgery, I want you to highlight the remaining paragraph and the bullet points. All right. Anna, go ahead and start reading the next paragraph, please.
Where it says surgical, ask.
Where it says various types of minor surgical operations.
Various types of minor surgical operations are performed in the medical office, such as insertion of structures. Sorry, the how do you say that?
Sebaceous cyst
Sebaceous.
removal.
Sebaceous cyst removal, incisions and drainage of infections, mole removal, needle biopsy, cervical biopsy, and ingrown toenail removals. The physician explains the nature of the surgical procedure and any risk to the patient and to offers to answer questions. The medical assistant is responsible for preoperative instructions, examples explaining the patient's preparation requires for the procedure, and for obtaining forms which grants the physical permission to perform the surgery. Figure 10.1.
Okay, very good. So I want you guys to highlight where it says the medical assistant is responsible for preoperative instructions and highlight until the end of that paragraph. So when it comes to even minor office surgery, the medical assistant is responsible for not only going over instructions to the patient on preparation. So if they need to do anything prior to the procedure, they need to go over what the procedure is, make sure they answer any questions for the patient. You also must get a consent form before we do anything, and that consists of injections, giving a patient medication in the office, and minor office procedures or any procedures that matter. We must have a consent before the provider can touch the patient. All right, Lily, go ahead and read the next paragraph, please.
Additional responsibilities of the medical assistant include preparing the treatment room, preparing the patient, carrying the minor surgery tray, assisting the physician during the procedure, administering conservative care to the patient, and cleaning the treatment room after the procedure.
Very good. Go ahead and highlight that whole paragraph. Natalie, go ahead and read the next paragraph. Natalie, can you hear me? Natalie. Talia, go ahead and read the next paragraph, please.
The treatment room must be spotless clean, and the medical assistant should ensure that adequate lighting for the procedure. The patient is positioned and draped according to the procedure to be performed. The skin is prepared as specific by the physician. Hair around the operative site is a contamination may need to be removed by shaving. The skin is cleansed and the appropriate anesthetic is applied to the area to reduce the number of microorganisms present.
All right, very good. Thank you. The medical assistant prepares the minor surgery tray using sterile technique. Highlight that sentence. The specific instruments and supplies included in each setup vary, depending on the type of surgery to be performed and the physician's preference. The medical assistant must become familiar with the instruments and supplies required for each surgical procedure performed in the office. During the minor surgery, the medical assistant is present to assist the physician as needed and to support the patient. The medical assistant should become completely familiar with the assisting techniques, for example, swabbing blood from the operative site, required for each surgical procedure performed in the medical office, and should learn to anticipate the physician's needs to help the procedure go quickly and smoothly. After the minor surgery, the medical assistant should remain with the patient as a safety precaution to prevent accidental falls and other injuries and to make sure the patient understands the post-operative instructions. The medical assistant removes and properly cares for all used instruments and supplies and cleans the treatment room in preparation for the next patient. All right, surgical asepsis. Alicia, go ahead and read the first paragraph, please.
Okay. Surgical asepsis, also known as sterile technique, refers to the practices that keep objects and areas sterile or free from all living microorganisms and spores. Surgical asepsis protects the patient from pathogenic microorganisms that may enter the body and cause disease. It is also always employed under the following circumstances: when caring for broken skin, such as open wounds and suture punctures; when a skin surface is being penetrated by a surgical incision for a mole removal or the administration of an injection, the needle must remain sterile; and when a body cavity is entered that is normally sterile, such as during the insertion of a urinary catheter. Instruments and supplies are sterilized through the use of disposable sterile items and by sterilizing reusable articles.
All right, very good. Okay, so you are going to highlight the first two sentences, and I want you to highlight where it says, when caring for broken skin, such as open wounds and suture punctures, when a skin surface is being penetrated as by a surgical incision for a mole removal or the administration of an injection. Highlight where it says, and when a body cavity is entered that is normally sterile, such as during the insertion of a urinary catheter. All right, Anna, can you go ahead and read the next paragraph, please?
A sterilized object that touches an unsterilized object is automatically considered contaminated and most and must not be used. If the medical assistant is in doubt or has a question concerning the sterility of an article, he or she should consider it contaminated and replace it with a sterilized article.
Very good, thank you. All right, ladies, go ahead and highlight that whole paragraph. All right, Lily, go ahead and read the next paragraph, please.
Sterility of the hands cannot be attained. Sanitizing the hands renders them medically
Aseptic.
and must be performed before and after every surgical procedure using proper technique. To prevent contamination of sterile articles, sterile gloves must be worn while picking up or transferring articles during the sterile procedure. Procedures 10.1 describes the procedures of applying these sterile gloves.
Very good. Specific guidelines must be observed during a sterile procedure to maintain surgical asepsis. See the accompanying box guideline for surgical asepsis. So really quickly, before we go into the instruments used in minor office surgery, let's go and take a look at the guidelines for surgical asepsis. Okay, so on number 1, I want you to highlight the first sentence. On number 2, highlight where it says a 1-inch border around the sterile field is considered contaminated. 3, highlight always face the sterile field. 4, hold all sterile articles above waist level. 5, place all sterile items in the center. 6, be careful not to spill water or solutions on the sterile field. 7, do not talk, cough, or sneeze over the sterile field. 8, do not reach over a sterile field. 9, do not pass soiled dressings over the sterile field. Okay, so if you're standing on one side of the patient table, you have your patient in front of you laying on the table, and your provider is across from you. You do not cross your area. I'm not going to reach over on the other side. The only thing I'm going to do is I'm going to meet my provider in the middle. Okay? Anything that is from my waist down is not sterile, which means if I'm sterile and I have sterile gloves on, I never bring my hands down. My hands are always going to remain up above waist level. Okay? Any questions about anything so far? All right, instruments used in minor office surgery. Natalie, go ahead and read that paragraph, please.
A variety of surgical instruments are used for minor office surgery. Most instruments are made of stainless steel and have either a bright, highly polished finish or a dull finish. The medical assistant should become familiar with the name, use, and proper care of all instruments used in the medical office. Surgical instruments are named according to one or more of the following function, e.g. splinter forceps, design, mosquito hemostatic forceps, and 3, the individual who developed the instrument. Kelly hemostatic forceps. The parts of an instrument are illustrated in figure 10.2. Some common instruments are described here and illustrated in figure 10.3.
All right, very good. Thank you. So let's take a quick look at figure 10.2, parts of an instrument. So they both have ring handles, but only the hemostats, which are going to be located on the right, have ratchets. They both have box lock. They both have blades. So on the hemostats, the one of the tips is sharp, so it can be used as a blade. And then, of course, they both have tips. All right, very good. Sabrina, go ahead and read scalpels, please.
A scalpel is a small, straight surgical knife consisting of a handle and a thin, sharp steel blade. A scalpel is used to make a surgical incisions and divide tissue with the least possible trauma to surrounding structures. Both disposable and reusable scalpels are available. A disposable scalpel consists of a non-slip plastic handle and a permanently attached steel blade that is individually packaged to maintain sterility. Scalpels are reusable, consist of a reusable stainless steel handle to which a disposable steel blade is attached. The blade comes individually packaged in a moisture-proof sterile package.
Very good, thank you. Okay, so you're going to highlight the first sentence. So in your office, you may actually see both. You will have disposable sterile blades, which are already attached to the blade handles, and those are generally plastic, and they'll have like a little plastic cap over the blade. Or you'll also have your sterile steel surgical blade, in which you would apply the sterile surgical blade to the handle for your provider. So you may have, I bet you have both, which is pretty common. All right, scissors. Talia, go ahead and read the first paragraph, please.
Scissors are cutting instruments that have ring handles and straight or curved blades. Both blade tips may be sharp. Both may be blunt, or one tip may be blunt and the other sharp. The two parts of a pair of scissors two parts of scissors come together as a hinge joint known as the box lock. These types of scissors employed depends on the intended use. The various types of scissors are listed and described next.
Very good. Okay, so we have operating scissors. Highlight that operating scissors have straight, delicate blades with sharp cutting edges and are used to cut through tissue. They are available with sharp, sharp, blunt, blunt, or blunt, sharp blade tips. Suture scissors are used to remove sutures. Highlight the hook on the tip aids in getting under a suture, and the blunt end prevents puncturing the tissues. Bandage scissors are inserted beneath a dressing or bandage to cut it for removal. Highlight the flat, blunt pro can be inserted beneath a dressing without puncturing the skin. Dissecting scissors. Highlight that they have a thick, beveled blades with a fine cutting edge used to divide or separate tissue rather than cut it. Dissecting scissors are available with straight or curved blades. Both tips of dissecting scissors are blunt. All right, does anybody have any questions so far? Okay. Alicia, go ahead and read the first paragraph for forceps.
Forceps are instruments for grasping, squeezing, or holding tissue or an item such as sterile gauze. Some forceps have two prongs and spring handles. Example, thumb, tissue, splinter dressings forceps that provides the proper tension for grasping an object such as tissue, a foreign object, or sterile gauze. Some forceps have serrations, example thumb and hemostatic forceps, which are a saw-like teeth and grasp tissue and prevent it from slipping out of the jaws of the instrument. As shown in figure 10.3, some varieties have tooth clasps on the handles known as ratchets. See figure 10.2. To hold the tips securely together and lock them in place, example Ali's tissue forceps, hemostatic forceps. The ratchets are designed to allow locked closure of the instrument at 2 or more positions. The various types of forceps are listed and described next.
Very good. Okay, so I want you ladies to highlight the first sentence under forceps. Okay, so just like we have different type of scissors, we have different type of forceps. So I want you to highlight the word thumb forceps. Thumb forceps have serrated tips and are used to pick up tissue or to hold tissue between adjacent surfaces. Highlight the word tissue forceps. Highlight that tissue forceps have teeth, which are used to grasp tissue and prevent it from slipping. Tissue forceps are identified by the number of opposing teeth on each jaw, for example, 1 by 2, 2 by 3, or 3 by 4. Tissue forceps are sometimes referred to as rat tooth forceps because the pointed projections resemble the teeth of a rat. The teeth should approximate tightly when the instrument is closed. Highlight the word splinter forceps. Splinter forceps have sharp points that are useful in removing foreign objects such as splinters from the tissues. Dressing forceps, highlight those two words, are used in the application and removal of dressing. Highlight that they are also used to hold or grasp sterile gauze or sutures during a surgical procedure. Dressing forceps have blunt ends that contain coarse cross serrations used for grasping. Highlight the words hemostatic forceps. Hemostatic forceps have serrated tips, ratchets, ring handles, and box locks. I can't talk, ladies. I'm so sorry. And are available with straight or curved blades. Highlight hemostats are used to clamp off blood vessels and to establish hemostasis until the vessels can be closed with sutures. The serrations on a hemostat prevent the blood vessel from slipping out of the jaws of the instrument. The ratchets keep the hemostat tightly shut and locked in place when it is closed. The ring handles allow for a secure grasp of the hemostat and are also used to select the desired ratchet position. The serrated blades should mesh together smoothly when the hemostat is closed. If they spring back open, the instrument is in need of repair. Highlight mosquito hemostatic forceps have small, fine tips and are smaller and more delicate than standard Kelly hemostatic forceps. Mosquito hemostatic forceps are used to hold delicate tissue or to clamp off smaller blood vessels, whereas standard hemostatic forceps used to grasp and compress larger blood vessels. Highlight the word sponge forceps. Sponge forceps have ring handles, ratchets, box locks, and highlight large serrated rings on the blade tips for holding sponges. A sponge is a porous absorbent pad such as a 4-inch gauze pad used to absorb fluid, apply medication, or cleanse the area. Miscellaneous instruments. My goodness. Various miscellaneous instruments used in the medical office are listed and described next. Needle holders, highlight those words, have serrated tips, ring handles, ratchet, and box locks. A needle holder is used to firmly grasp a curved needle for insertion of the needle through the skin flaps of an incision. The serrated tips of the needle holder are designed to hold a curved needle securely without damaging it. A needle holder is sometimes referred to as a driver because it functions to drive the curved needle through the skin. So if I'm saying needle holder and I'm saying it's designed to hold a curved needle, what do we think would be considered a curved needle? Any ideas? There is no right or wrong answer. I'm just seeing if you guys know.
What do you mean?
So it says curved needle. So
Yeah.
what do we think that would be considered of? If we think minor office surgery, what is something that would be a curved needle?
For sutures? I don't really know what you mean.
Yes.
Oh, okay. I was like, what? I was confused.
Yes.
Okay, yeah.
And you'll see it when we get to the clinic. So like I said, there's no right or wrong. I just want to kind of see. So the reason I'm saying this is because needle holders in your office, they may also be referred to as suture holders. Because a suture needle, it's almost like the end of a fish hook, okay? So it's curved and then your suture is attached to that needle. The needle holder is designed to grasp down on that suture and you hold it as you go in and out of the tissue. And it's used because it doesn't damage the suture needle. So you may see it referred to as needle holder or suture holder because of that reason. All right, very good. So then we have retractors. Highlight that word. Highlight that they're used to hold tissue aside to improve the exposure of the operated area. All right. Now, before we go into the next paragraph, I want you to take a look on page 320, page 321, 322, and 323. Now, because there are so many options of instruments that you will find in your office, and obviously in this chapter, a good thing to do to help study, I recommend you ladies trace these instruments out, label the back of them, and put yourself together some flashcards. Now, for the scalpels, you will see both sizes of scalpels probably in your office. That's a common instrument. Operating scissors, that is a common instrument. That's used to cut tissue. And you may see it as the operating scissors sharp, so that's what they mean if it's sharp or sharp blunt. Literature suture scissors. This is a common instrument in your office. It is not one that you're going to have on your instrument tray, but it is one that you are going to use to remove the sutures that have been in place on the patient. Lister bandage scissors. You may have some that are sterile and some that are not sterile. The non-sterile ones I always kept in my drawers in my patient rooms. So that way if I'm having to do a dressing change or whatnot, I have access to it. And then I also make sure that I have some sterile in case my provider needs them for any reason during a surgical procedure. Mayo dissecting scissors straight. That is a common one. So a lot of times when a physician makes an incision So it makes an incision on the skin. They want to cut the top layer of the skin from the muscle, and they will use the Mayo dissecting scissors to do that. So the scissors just slide right underneath the skin and they spread them apart. And then they can also cut them as well, and it kind of removes the layers that the physician needs. If I lose you ladies, please let me know. Another option of the Mayo dissecting scissors is you have straight and curved. I've seen both in the field. My providers liked using the curved ones better, so it will be your provider preference. Okay, so here we now we have forceps. So it says forceps, but what does that also look like?
I literally thought I can't think of the freaking word right now. You do your eyebrows, let them know.
Tweezers, yep.
Yeah, there you go. I could not think of it. It's like lost. It lost my brain for a second.
That's right. So your forceps are always going to have that shape of tweezers, right? But they do different things. So this is where it's very important in your office to make sure that you do examine your forceps. So you have your standard thumb forceps, and you can see that it at the very top of the forceps, it does have these little lines on the inside. That is not considered teeth. Okay? Now look to the next one, the standard tissue forceps. They have a 1x2 teeth and they use to grasp tissue. So look at the difference on the forceps on the left and on the right. The right, if your provider says, I need forceps with teeth, this is what they were referring to. It looks like little, well, mini rat teeth at the very end of it. This particular one is a 1x2. So why do we think that is a 1x2?
The size of it, kind
This,
of like the length and the width of the teeth.
yes. So on one side, you're going to see two little indentions, and on the other side, it's just the one. So when you bring them together, they make a secure connect, right? So that's what they mean by 1x2 teeth. But just like we learned earlier, there are different sizes. Now, I think most of the forceps in my office, they generally probably would have just the 1x2 teeth. I don't think I've commonly seen any more sizes than that. All right, very good. So then we have plain splinter forceps. Well, again, it looks like tweezers. And it's used to remove foreign objects from the tissue. So it's very thin, and then it's very sharp. It's very precise to get right to that foreign object and remove it. Okay? And then we have Adson dressing forceps to apply and remove dressing. This is a common forceps you will see in your office. These are designed with and without teeth. Very common. All right, the next one is Alice tissue forceps, used to grasp delicate tissue. That is a common one. All right, let's go on over to page 322. So now we have more forceps, but these look very different to the other forceps that we just seen. It's because these are what we consider hemostatic forceps. All right, so we have the straight or curved for the Kelly hemostatic forceps. We have Rochester Peen hemostatic forceps, again, straight or curved. Ochsner Kosher hemostatic forceps, straight or curved. Below that, we have the Halsted mosquito hemostatic forceps, straight or curved. So the common ones I can tell you that I've seen are going to be your Kelly hemostatic forceps and your Halsted mosquito hemostatic forceps, mostly probably curved. Now again, your office may have every single one of these. All right, the next one we have Forster sponge forceps to hold a sponge. I mean, that's pretty self-explanatory, and it looks, I mean, it's exactly how it looks. Cryle wood needle holder, used to grasp a curved needle. Now, on this one, you can see that there is a little slight opening in the middle. Some have that because you can, I remember one of my doctors said that you can actually slide the suture needle through it and then hold it to grasp, like it keeps it a tight snug. But I can tell you in 20 years, I've never used one. I've always used, it would be a needle holder, but there's no indentions on the outside of the needle holder. All right, Volkmann rake retractor. It looks just like your garden rake. It's used to hold tissue away so your provider has a better area on what they're doing and they can see a little bit better. You as a medical assistant may have to hold this device. All right, and then we have Graves vaginal speculum. Most offices have sterile speculums that may be disposable. Some offices may have them where you would need to sterilize them. It's not that common anymore to do that though. Uterine dressing forceps, to hold dressings for procedures involving the vagina, cervix, or uterus. Duple uterine tenculum, to grasp and hold the cervix. Sims sharp, to remove material from the wall of a cavity or other surfaces. All right, any questions about the instruments? Okay, let's go on to page 324. Gynecologic instruments. Lily, go ahead and read the gynecologic instruments, please.
Gynecologic surgical procedures are often performed in the medical office. The medical assistant should be familiar with the terms related to the gynecologic instruments. These are listed and described next. You want me to keep going?
Yes, ma'am, please.
A speculum is an instrument used to open or distend a body orifice or cavity to permit visual inspection. A vaginal speculum consists of two blades joined at one end, with the lower blade usually a little longer than the upper blade. It is inserted into the vagina and locked into a position to open and hold the walls of the vagina apart to allow visual inspection of the vagina and cervix. Urine dressing forceps are long, slender forceps that have serrated blades, ratchets, and lock slots. These forceps are used to hold dressings, such as sterile gauze, for absorbing fluids, applying medication, or cleansing an area of the vagina, cervix, or uterus. The uterine tenaculum is a hook-like instrument used to grasp and hold the cervix. A curette is a spoon-shaped instrument used to remove material from the wall of the cavity and other surfaces.
Very good. Thank you, Lily. Okay, so on the first bullet point, I want you to highlight the first sentence. On this second bullet point, I just want you to highlight the words uterine dressing forceps. On the third bullet point, I want you to highlight the words tentaculum. Okay, it's a hard word for me to say. And on the last bullet point, I want you to highlight the words a curette. Now, side note, curettes are very commonly used in almost all offices in one way or another. All right, any questions for at this point? Okay. Surgical instruments are expensive and delicate yet durable and last for many years if handled and maintained properly. The care an instrument receives depends to a large degree on the parts making up the instrument, for example, box lock, ratchet, cutting edge, or serrations. The medical assistant works with instruments while setting up a sterile tray, performing certain procedures such as suture removal and sterile dressing change, and cleaning up after minor office surgery, and during the sanitization and sterilization process. During each of these procedures, guidelines must be followed to prolong the lifespan of each instrument and to ensure its proper functioning. All right, Natalie, will you please read 1 and 2?
Always handle instruments carefully. Dropping an instrument on the floor or throwing an instrument into a basin could damage it. Do not pile instruments in a heap because they become entangled and might be damaged when separated.
Very good. On number 1, highlight the words always handle instruments carefully. And on number 2, do not pile instruments. Talia, will you please read 3 and 4?
Keep sharp instruments separated from the rest of the instruments to prevent damaging or dulling the cutting edge. Also, keep delicate instruments such as lens instruments separated to protect them from damage. To prolong the proper functions of the ratchet, keep instruments with a ratchet in an open position when not in use.
Very good, thank you. For number 3, highlight the words keep sharp instruments separate and highlight all of number 4. Alicia, will you please read 5 and 6?
Rinse blood and body secretions off an instrument as soon as possible to prevent them from drying and hardening on the instrument. When performing procedures that require surgical instruments, always use the instrument for the purpose for which it was designed. Substituting one type of instrument for another could damage it. Sanitize and sterilize instruments using proper technique. I'm sorry, I read the rest because it was little.
That's okay, thank you. All right, on number 5, highlight the words rinse blood and highlight as soon as possible. On number 6, highlight always use the instrument for the purpose for which it was designed. And on number 7, highlight the words sanitize and sterilize. So a few chapters ago, I asked you guys, or I told you guys the one thing after cleaning up from a room that you do with your instruments before you take your instruments to the lab. What was that thing?
You sanitize them,
Yes, but what's the
rinse
first
them off.
thing you're going to do before you even take those instruments out of that room you just used them in?
Wash your hands. I don't know.
Yeah, but that's not really what I'm looking for.
Rinse them off.
Nope, something else. Cover them. That's a good one, but I'm looking for something else. That's also a good one. Okay, well let me say this. Out of all the providers that I work for, they all shared one common thing. When they were done with the procedure, they laid the instruments down right away. Do you think the provider took off the blade on the blade holder?
Yes. No, yeah, yeah. You have to separate the blades from the instruments because then yeah, okay. I remember now. Okay.
Yep. So, before, as a medical assistant, your provider probably is not going to clean up after themselves. But guess what? It's your job. Your job is to know your physician. I know my physicians, some will make sure that the suture needle is off and is on a separate part of the tray. Some didn't care. They left everything right on the surgical tray with bloody gauze and everything else on top of it. Well, it's my job to clean up, right? Now, because I was in the room, or even if I'm not in the room, I'm going to carefully dispose of each item properly because of the fact you do not know what's underneath all that. And the last thing you want to do is get stuck with something that was just used in somebody else's body. So, you're done with your surgery, your provider's off to go see the next patient, and you're cleaning up. You're going to carefully remove and dispose of each item properly until you get to the base of the instruments, and then you are going to carefully look at the instruments before you just put your hand down in there and touch them. If the surgical blade is on the blade handle, you're going to carefully dispose of the blade and put in the sharps. If there is a suture needle, you're going to carefully dispose of that in the sharps. You're going to go through each and every item. Then, with your gloves on, take your instruments, cover them, and before I come out of my room, I'm going to yell, "Instruments in hand." Now, why do you ladies think I'm going to do that?
Because some medical assistants and providers, they don't pay attention, they can run into you.
That's right. That's right. Exactly. So you may be extremely busy and people are just running around your office. This is for your protection and for theirs. I'm going to holler. You may not like it, but it's for the better choice. Then I'm going to take my instruments into my lab or wherever that we clean our instruments at. I'm going to place the cover in the appropriate designation, whether it be a biohazard bag, trash, linen disposal, wherever it may go. And then I'm going to rinse my instruments off. And at that point, I've rinsed my instruments off. Then I'm going to look in my disinfecting solution that my instruments need to soak. And I'm going to make sure that I don't see anything sharp before I put my instruments into my solution. And then even if you are going back and you are picking the instruments out of the solution, you again look before you put your hand in that solution. And as always, you are gloved. All right, any questions on that? All right, very good. Commercially prepared sterile packs. Let's see. Anna, will you go ahead and read the first paragraph, please?
Commercial prepaid disposable packets are used frequently and may contain one particular article. Example: sterilized dressing or a complete sterile setup. Example of one for the removal of structures. However you say that word.
Sutures.
Sutures. The direction for opening the package are stated on the outside of the package. They should be followed carefully to prevent contamination of the sterile contents. Procedure 10.2 describes opening a sterile package.
Very good, thank you. All right, Lily, go ahead and read the next paragraph, please.
One type of commercially prepared package is the peel part package. package, commonly referred to as a pill pack. This type of sterile package has an edge with two flaps that can be pulled apart in the following manner. Grasp each unsterile flap between your bent index finger and extended thumb, and rolling your hand outward, pull the package apart. The inside of the wrapper and the contents are sterile, and to prevent contamination, they must not be touched with the bare hands. The medical assistant can place the contents of the peel pack directly on the sterile field by stepping back slightly from the field and gently injecting or flipping the contents into the center of the sterile field. Stepping back prevents the unsterile outer wrapper and the medical assistant's hands from crossing over the sterile field, which would result in contamination.
All right, very good. Thank you. Okay, so you're going to highlight the first and second sentence on the second paragraph. And I want you to also highlight that the medical assistant can place the contents of the pill pack directly on the sterile field by stepping back slightly from the field and gently ejecting or flipping the contents onto the center of the sterile field. Okay, so peel apart package or pill pack. What is something that each of us may have in our home that symbolizes this right here? Any ideas?
A Band-Aid.
Very good. Yes, Band-Aid. So just like with the Band-Aid, there's a little flaps at the top and you peel that back and then you're able to get your Band-Aid. So at home, you can go ahead and start practicing a sterile technique. Whether it's you peel the Band-Aid back and flip it out, or you have a household member peel the bandage back and you pick it out. It's going to be the exact same technique as when you're in the office on any peel part package. All right, very good. Natalie, go ahead and read the next paragraph, please.
Where it says the contents?
Yes, ma'am.
Okay. The contents of the package also can be removed with a sterile gloved hand. This technique is useful during minor office surgery when the physicians need additional supplies such as gauze pads and sutures. The medical assistant opens the sterile package and the physician removes the sterile contents from the package using a gloved hand. Figure 10.4. C. The inside of the package can be used as a sterile field by opening the peel apart package completely and laying it flat on a clean, dry surface. Figure 10.4D.
Very good. All right, Sabrina, go ahead and read that last paragraph for me.
Where are we at?
On page 325, right above the pictures on the right side, it's that very last paragraph.
The one's a sterile package.
Once a sterile package, yes.
Okay. Sorry, that's my dog.
Okay.
Okay, once a sterile package has been opened and set up, the medical assistant may need to pour a sterile solution, such as an antiseptic, into a container located on the field. To do so, the steps of surgical asepsis outlined in procedure 10.3 should be followed.
Very good. Okay, so you are assisting your provider in a sterile procedure. You are sterile. You have on your sterile gloves and whatnot, and it is just you and your provider in the room, and your provider needs supplies. Medical assistant, what do you do?
That one more time.
It is just you and your provider in a room doing a surgical procedure. You, medical assistant, are sterile, and so is your provider. You have sterile gloves on and everything. And your provider needs more supplies. What do you do?
Can you just remove your gloves and then re-sterilize after you get the supplies?
Yes, you can, but how would you do that? What does that involve?
Removing your gloves,
And,
washing your hands.
yep. And what else? How would you hand the supplies to your provider? Because your provider is sterile.
You'll re-sterilize, won't you, before you do that?
Well, at that moment, you probably wouldn't because you need to be able to hand your provider, who is still sterilized, the supplies that he needs. And right now, you are no longer in that sterile field. So, what is something that you would do to make sure your provider stays sterile and is able to get these sterile supplies that he or she is requesting?
What is he requesting?
Anything. He's requesting more sutures and gauze. I'll give y'all a hint. Peel pack.
Yeah, I mean, like it says, to peel it apart and let them take it or
That's
flip it over.
that's right. Very
But
good.
so, okay, you can do that for that because it's easy and there's flaps that you can hold while they grab that. So what about sutures?
Sutures is going to be the same thing. So all
Oh,
sterile
so you'll open the
sutures,
pack regardless and let them take it.
that's
Okay.
right. Most all supplies now are peel pack. Okay, so
Okay.
you can always, even if your provider is not sterile, you still want to practice that method. Okay, so you your provider requested supplies. I'm going to take off my sterile gloves and I'm going to dispose of them properly. I'm going to wash my hands. I'm going to go gather my supplies. I'm going to peel pack. I'm going to open them, let my provider take the supplies that he or she is needing. And then I'm going to go wash my hands and I'm going to put new sterile gloves on and I'm going to go back into the sterile field. All right, so you have to be able to kind of start thinking about that whole entire process. Okay, so if you're from a sterile field and you have to leave that sterile field, you have to become back into a sterile field. You can't just throw some gloves on and walk back in. And you can't hand your provider supplies because you are not sterile and he is. And if he's to touch what you just handed him, everybody just broke a sterile field. So you have to kind of think about it. So the peel pack is such a good thing. Start doing it now. And if your provider's sterile or not, practice the same thing. Open it up, let them choose to take it. Okay? All right, very good. Any questions over any of this right now?
No, ma'am.
Okay, very good. All right, so procedure 10.1 is applying and removing sterile gloves. This is a great procedure to read. And with the gloves that are in your baggie, it's something that you can go ahead and start practicing. And although it's not quite the same, but you still can get the feel of applying and removing gloves. But I definitely make sure you read over this procedure. All right, now I want you guys, so procedure 10.2 is opening a sterile package. And this is something we touched base, I think it was on chapter 2, just a little bit, but we're going to touch base at it in the clinic. It's also a good read, study on that. And then procedure 10.3, pouring a sterile solution. Okay, so I want you guys to highlight on page 329 on number 2 procedural step, highlight the words check the expiration date. I want you to highlight all of number 4 procedural step and principle, and all of procedural step 5 and principle. And then we're going to turn to page 330. Okay, so at the very top on page 330, it's the end of procedure 10.3, pouring a sterile solution. So again, you don't hand your provider the item, right? I'm not going to hand him a bottle of betadine or Hibiclens. I'm going to pour the solution into a bowl that is on his sterile tray. Most surgical trays will have a bowl inside of the pack. So I'm going to pour the solution without touching the tip of the bottle to the bowl. I'm going to hold it high up and I'm going to pour. And my provider will probably tell me, all right, that's good, thank you. And then I'm going to remove the bottle and get sterile. All right, so now we are on to wounds. Natalie, go ahead and read the first paragraph, please.
A wound is a break in the containment of an external or internal surface caused by physical means. Wounds can be accidental or intentional, as when the physician makes an incision during a surgical operation. There are 2 basic types of wounds, closed and open.
All right, very good. Highlight the first sentence and the last sentence. Talia, will you go ahead and read the next paragraph, please?
A closed wound involves an injury to the underlying tissue of the body without a break in the skin surface or mucous membrane. An example is a contusion or bruise. Is that a cushion?
Contusion.
A contusion results when the tissue under the skins are injured, often caused by a blunt object. Blood vessels rupture, allowing blood to steep into the tissues, which results in a blush decoloration of the skin. After several days, the color of the contusion turns greenish yellow as a result of oxidation of the blood pigments. Bruising commonly occurs with injuries such as fractures, sprains, strains, and black eyes. Open wounds involve a break in the skin surface or mucous membranes that expose the underlying tissues. Examples include incisions, lacerations, punctures, and abrasions. Figure 10.5 illustrates specific wounds.
All right, very good, thank you. Okay, so on this paragraph, you're actually going to highlight the first 3 sentences and the last sentence. All right. Alexis, are you able to read that first bullet point? You may not be able to. All right, Alicia, go ahead and read that first bullet point for me.
An incision is a clean, smooth cut caused by a sharp instrument such as a knife, razor, or a piece of glass. Deep incisions are accompanied by profuse bleeding. In addition, damage to muscles, tendons, and nerves may occur.
Very good. Highlight the first sentence. Okay, Alexis, thank you. All right, Anna, go and read the next bullet point, please.
A laceration is a wound in which the tissues are torn apart rather than cut, leaving ragged and irregular edges. Lacerations are caused by dull knives, large objects that have been driven into the skin, and heavy machinery. Deep lacerations result in profuse bleeding, and a scar often results from the jagged tearing of the tissue.
All right, very good. Same thing, highlight that first sentence. Lily, go and read the next bullet point, please.
Puncture is a wound made by a sharp-pointed object piercing the skin layers, for example, a nail, splinter, needle, wire, knife, bullet, or animal bite. A puncture wound has a very small external skin opening, and for this reason, bleeding is usually minor. A
Tetanus.
tetanus booster may be administered with the type of wound because the tetanus bacteria grows best in the warm anaerobic environment, such as the one in the puncture.
Very good. Okay, so on this one, you're going to highlight the first sentence and the last sentence. All right, Natalie, go ahead and read the last bullet point, please.
An abrasion or scrape is a wound in which the outer layers of the skin are scraped or rubbed off, resulting in oozing of blood from ruptured capillaries. Abrasions are often caused by falling on gravel and floor burn. These falls can result in skinned knees and elbows.
All right, very good. I want you to highlight on this one, which is where it says an abrasion or scrape. All right, so a contusion is where something basically hurts the lower layers of the tissue and muscles and form like a bruise, correct? An incision is a very straight edge cut. Laceration, I mean, it's almost like a tear in a sheet. It may not tear in a straight line. It's going to be kind of jagged. A puncture, think of a nail going into a piece of wood. That's a puncture. And then an abrasion may be like a carpet burn on your elbows, or maybe even a slight scrape, maybe even a light burn on your hands. So just anything that causes just enough to where the skin is irritated, but it's not really much of an open wound, right? All right, any questions on that? Okay. Wound healing. The skin is a protective barrier for the body and is considered its first line of defense. Highlight that sentence. When the surface of the skin has been broken, it is easy for microorganisms to enter and cause infection. The body has a natural healing process that works to destroy invading microorganisms and to restore the structure and function of damaged tissues, as is described next. Highlight that last sentence. Phases of wound healing. Wound healing occurs in 3 phases, which are described here and illustrated in figure 10.6. Phase 1, also called the inflammatory phase, highlight that, begins as soon as the body is injured. This phase lasts approximately 3 to 4 days, highlight that. During this phase, a fibrin network forms, resulting in a blood clot that plugs, highlight that, up the opening of the wound and stops the flow of blood. The blood clot eventually becomes the scab. The inflammatory process also occurs during this phase. Highlight inflammation is the protective response of the body to trauma, such as cuts and abrasions, and to the entrance of foreign matter such as microorganisms. During the inflammation, the blood supply to the wound increases, which brings white blood cells and nutrients to the site to assist in the healing process. Highlight the 4 local signs of inflammation are redness, swelling, pain, and warmth. The purpose of inflammation is to destroy invading microorganisms and to remove damaged tissue debris from the area so that proper healing can occur. Let's see. Talia, can you go ahead and read the next paragraph, please? Alicia, go ahead and read the next paragraph, please.
Phase 2 is also called the proliferative phase and typically lasts 4 to 20 days. During this phase, fibroblasts migrate to the wound and begin to synthesize collagen. Collagen is a white protein that provides strength to the wound. As the amount of collagen increases, the wound becomes stronger and the chance that the wound will open decreases. There is also a growth of new capillaries during this phase to provide the damaged tissue with an abundant supply of blood. As the capillary network develops, the tissue becomes a translucent red color. This tissue is known as granulation tissue. Granulation tissue consists primarily of collagen and is fragile and shiny and bleeds easily.
All right, very good. I want you to highlight the first 2 sentences on phase 2, please. Anna, go ahead and read phase 3.
Phase 3, also known as the maturation phase, beginning as soon as granulation tissue forms, it can last for 2 years. During this phase, collagen continues to be syntheticized, and the granulation tissue eventually hardens to a white scar tissue. The scar tissue is not true skin and does not contain nerves or have a blood supply. The medical assistant should always inspect the wound when providing wound care. The wound should be observed for signs of inflammation and the amount of healing that has occurred. This information should be documented in the patient's record.
Very
Okay,
good.
so I have a question about that.
Yes.
So, for like some moms, they get a C-section and like the scar. So, phase 3, it says scar tissue doesn't have like any feeling, but I can still feel mine.
Well, and you'll actually find that more often than not. Some patients will still have a sensation, and some, it's not that it's more of a numbness. Like they feel something, but it doesn't feel like when they touch the rest of their skin. Okay. The other thing is, have any of you guys noticed when you get a cut, the cut has healed on the outside, but it's still really hard on the inside? Have you ever noticed that? So if you haven't, that's not a big deal. I want you to start paying attention to that in the future because your patients will actually complain of this. And a lot of that is because, yes, my cut is healed on the outside, but your skin is still healing on the inside. And the first thing that you feel as your tissue is starting to heal is it becomes really hard. And then over time, that hardness starts fading away. So start paying attention to that. You'll start noticing it. It's pretty cool. All right. Any other questions on this part? All right. Lily, go ahead and read the first paragraph on wound drainage.
The medical term for drainage is exudate. An exudate is a material such as fluid and cells that has escaped from the blood vessels during the inflammatory process. The exudate deposited in tissue or on tissue surfaces and is often present in a wound. When providing wound care, the medical assistant should always inspect the wound for drainage and document this information in the patient's medical record. There are three major types of exudates: serous, centrinage, and purulent.
Very good. Okay, I want you to highlight the first sentence on each bullet point. So we have serous exudate, consists chiefly of serum, which is the clear portion of the blood. Serous drainage is clear and watery. An example of serous exudate is the fluid in a blister from a burn. Sanguineous exudate is red and consists of red blood cells. This type of draining results when capillaries are damaged, allowing the escape of red blood cells, and is frequently seen in open wounds. A bright red sanguineous exudate indicates fresh bleeding, and a dark exudate indicates older bleeding. Okay, has anybody heard someone say this last sentence? And there is no right or wrong. I'm just asking. So when you deal with patients who have digestive issues and intestine issues, you will hear your provider ask them this question. Okay, so digestive issues means if a patient is showing signs of an ulcer, they are going to have nausea, vomiting, heartburn, and the vomiting could be bright red blood, dark red blood, or what we call coffee grinds. Okay, intestinal bleeding, same thing. We're going to ask them, have you noticed any bright red blood in your stools or dark black color in your stools? Okay, and that's why we're asking, because bright red consists of fresh bleeding. So if it is intestinal, it could be the irritation for maybe constantly being sick during the ulcer, or for whatever, maybe even indigestion, because sometimes that causes vomiting as well. For intestinal, if it's bright red, it could be a tear in the rectum, maybe a hemorrhoid, could be anything. Not too concerning, but we're still going to document it. And then dark blood for digestion could consider of old. So it could be a very serious ulcer. It also could be pertaining to other things with serious diseases. Same thing for intestinal. It could be a intestinal bleed. It could be inflammation. I mean, it can be some serious indicants of diseases. So you will hear that being asked. And as a medical assistant, if you have some patients who state that they're noticing red, or like maybe it's blood, ask them, is it bright red or dark? And go and document that. Okay, purulent exudate. A purulent exudate contains pus, which consists of leukocytes, dead liquefied tissue debris, and dead and living bacteria. Purulent drainage is usually thick and has an unpleasant odor. It is white in color but may acquire tinges of pink, green, or yellow depending on the type of infecting organism. The process of pus formation is suppuration. In addition to the exudates just described, Highlight mixed types of exudates are often observed in a wound. Highlight a serosanguinous exudate consists of clear and blood-tinged drainage and is commonly seen in surgical incisions. Highlight a purosanguineous exudate consists of pus and blood and is often seen in new wound that is infected. All right, any questions? All right, this one's a pretty big chapter. All right, Natalie, go ahead and read the first paragraph under sterile dressing change.
Surgical asepsis must be maintained when no one is caring for and applying a dry sterile dressing, abbreviated as DSD, to an open wound. The medical assistant must take care to prevent infection in clean wounds and to decrease infection in wounds already infected. The function of a sterile dressing is to protect the wound from contamination and trauma, to absorb drainage, and to restrict motion, which may interfere with proper wound healing. The size, type, and amount of dressing material used during a sterile dressing change depend on the size and location of the wound and the amount of drainage.
All right, very good. So I want you to highlight the sentence that says the function of a sterile dressing is to protect the wound from contamination and trauma, to absorb drainage, and to restrict motion, which may interfere with proper wound healing. Talia, go ahead and read the next paragraph, please.
Sterile folded gauze pads are used in the medical office for a sterile dressing change. This type of dressing absorbs drainage, but the gauze have the tendency to stick to the wound when the drain dries. Gauze pads come in a variety of sizes, including 4x4, 3x3, 2x2, and the 4x4 size is the most used frequently.
Very good. All right, I just want you to highlight the first sentence on that paragraph. Alicia, go ahead and read the next paragraph, please.
I almost dropped my book.
It's okay.
Okay. Non-adherent pads are also used as a sterile dressing. They have one surface impregnated with agents that prevent the dressing from sticking to the wound. One brand of this type of material is Telfa pad. The non-adherent side, which is shiny, is placed on next to the wound. Telfa dressings are often used to cover burn skin. Procedure 10.4 presents the procedure for changing a sterile dressing.
All right, very good. I just want you to highlight the words non-adherent pads. Telfa pads are my favorite. All right, I want you ladies to turn to page 334. On number 12, procedural step, highlight B. All right, now sutures. Yay, I love sutures. Highlight the first sentence. Insertion and removal of sutures are commonly performed in the medical office. Sutures may be required to close a surgical incision or to repair an accidental wound. The approximate or bring together the edges of the wound with surgical stitches and hold them in place until enough healing has taken place so that the wound can withstand ordinary stress and no longer needs support from the sutures. Highlight that sentence. Sutures also protect the wound from further contamination and minimize the amount of scar formation. A local anesthetic is necessary to numb the area before sutures are inserted. As a medical assistant, you may be the one to inject local anesthetic. All right, types of sutures. Sutures are available in two types, absorbable and non-absorbable. Absorbable sutures are made of a material that is gradually digested and absorbed by the body in a relatively short period of time. Highlight those last two sentences. The amount of time can range from 7 days to several months, depending on the type of tissue being sutured and the size and type of absorbable suture being used. Absorbable sutures consist of surgical gut, SurgiGut, highlight that, or synthetic materials such as polyglycolic acid, highlight the word Dexon, polyglatin 910, highlight the word Vicryl, polydioxanone, highlight the words PDS2, polyglyconate, highlight the words Maxon, polyglyclaprone, highlight the words monocryl, lactomere, highlight the words polysorb, and capricin, highlight that word. A surgical gut is made from sheep or cow intestine, highlight that sentence. This type of suturing material is gradually digested by tissue enzymes and is absorbed by the body's tissues 7 to 21 days after insertion, depending on the kind of surgical gut employed. Plain surgical gut has a rapid absorption time, whereas chromic surgical gut is treated to slow down its rate of absorption in the tissues. Absorbable sutures frequently are used to suture subcutaneous tissue, fascia, intestines, bladder, peritoneum, and to ligate or tie off vessels, because suturing of this type of tissue is typically done during surgical performed by a physician in a hospital where the patient is under general anesthetic. The medical office may not stock absorbable suture material. Dermatologists and general surgeons will. All right, non-absorbable sutures are not absorbed by the body and may remain permanently in the body tissues and become encapsulated by fibrous tissues or may be removed. Highlight that sentence. For example, skin sutures. Non-absorbable sutures are used to suture skin. This type of suture is used frequently in the medical office. Non-absorbable sutures are made from the materials that are not affected by tissue enzymes. These materials include silk or soft silk, nylon, ethylene, polyester, Tycron or Surgidac, or polypropylene, Prolene, or Surgipro, polybutester, Nonafil and Vascufil, stainless steel and surgical skin staples. All right, figure 10.7 on page 336. Any questions so far, ladies? All right, so let's take a look at A. Swagged suture packs. A is absorbable sutures and B is the non-absorbable sutures. All right, now let's look at figure 10.8 on page 337. Sutures come in a box and are individually packaged. Each suture package consists of an outer peel-apart envelope and a sterile inner packet. All sutures are designed this way. So you may have to take the sutures out of the box, but they're enclosed in an outer wrapping that you will peel apart and either hand to your provider or put on your surgical tray. All right, Anna, go ahead and read the first paragraph for suture size and packaging.
Sutures are measured by their gauge, which refers to the diameter of the suturing material. The sizes ranges from numbers below 0, pronounced ought, to numbers above the diameter of the suture material increase with each number above 0 and decrease with each number below 0. If the size of a particular suture material ranges from 7 to 0 to 5, available sizes include 7-0, 6-0, 5-0. Am I saying that right?
Yeah.
Okay. 5-0, 4-0, 3-0, 2-0, 0, 1, 2, 3, 4, and 5. Size 7-0 sutures are very fine sutures, and size 5 sutures are very heavy sutures. Sizes 2-0 or the 00 sutures have a smaller diameter than a size 0 sutures.
All right, very good. Okay, so I want you to highlight where it's the diameter of the suture all the way down to the words heavy sutures. So I think it's 2 sentences. Okay, so your provider will refer to them as 7-0 ethlon or nylon or 70 nylon. So you may hear it either way. Most of my providers always said 70, 50, 40, 30 proline, things like that. All right, Lily, go ahead and read the next paragraph, please.
Non-absorbable sutures with smaller gauge are used for suturing incisions in delicate tissues such as face and neck, whereas non-absorbable heavy sutures are used for firmer tissues such as the chest and abdomen. Finer sutures leave less scar formation and are used when cosmetic results are desired.
Very good. Natalie, go ahead and read the next paragraph, please.
Where it says sutures come in a box, right?
Yes, ma'am.
Sutures come in a box of individually packaged sutures, figure 10.8a. The box of sutures is stamped with an expiration date that must be checked each time a suture package is removed from the box. Each individual suture package consists of an outer peel-apart envelope and a sterile inner packet, figure 10.8b. Packages are labeled according to the type of suture material, surgical silk, the size 4-0, the length of the suturing material 18 inches, the date of manufacture and the expiration date of the suture. The type and size of material used are based on the nature and location of the tissue being sutured and the physician's preference. To repair a laceration of the arm, the physician might use a 4-0 surgical silk suture. The physician informs the medical assistant of the type and size of sutures needed.
Very good, thank you. So your provider is not going to assume that you know what size sutures to grab, right? They're going to tell you, Natalie, go get me 3-0 proline. All right, you're going to go into your supplies and you're going to look for proline and grab the size 3-0. And your physician does have a preference for each thing, and you will start seeing a pattern if your physician does do sutures and minor office surgery. You will pick up on their pattern of what they like to grab, and you'll start getting used to that. All right, suture needles. Talia, go ahead and read the first paragraph, please.
Needles used for suturing are made from the stainless steel alloys and are categorized according to their type of point and their shape. A needle with a sharp point is a cutting needle, and one with a round point is a non-cutting needle. Cutting needles are used for firm tissues such as skin. The sharp points help push the needle through the tissue. Non-cutting or blunt needles are used to penetrate tissues that offers a small amount of resistance, such as the fascia, intestines, liver, spleen, kidneys, subcutaneous tissues, and muscles.
Very good, thank you. All right, so highlight where it says a needle with a sharp point is a cutting needle, and one with a round point is a non-cutting needle. All right, Alicia, go and read the next paragraph, please.
A suture needle may be curved or straight. See figure 10.9a. Curved needles permit the physician to dip in and out of the tissue. A needle holder must be used with a curved needle. A straight needle is used when the tissue can be displaced sufficiently to permit the needle to be pushed and pulled through the tissue. Straight needles do not require the use of a needle holder.
Very good. All right, highlight the first two sentences. Anna, go and read the next paragraph, please.
Some needles have an eye through which the suture material is inserted. However, most needles are swagged. Swag means that the suture and the needles are one continuous unit. The needle is permanently attached to the end of the suture. Swag needles are used frequently because they offers several advantage over eye needles. One advantage is that the suture material does not slip off the needle, as might occur with sutures material threaded through the eye of a needle. The other advantage is that the tissue trauma is reduced because a swag needle has only a single strand of suture that must be pulled through the tissue compressed with a double strand in an eye needle. The swag needle can be pulled through the tissue with less resulting trauma. Swag suture packets are labeled to specifically to gauge a type and length of the suture material, the types of needle points, cutting and non-cutting, and the needle shape, curved or straight.
All right, very good. So I want you guys to highlight where it says swagged means that the suture and needle are one continuous unit. Also highlight where it says swagged suture packets are labeled to specify the gauge, type, and length of suture material, the type of needle point, cutting or non-cutting, and the needle shape, curved or straight. All right, so eye needles. Let's look at figure 10.9. What would we use eyed needles for? Any ideas?
Stitches?
Yeah, but you probably are going to see and use them more frequently in your home doing this.
Oh, sewing.
Yep. Yeah. So when they say eyed needles, that's what I want you to picture. So it's where it's the needle, the sharp end of the needle is down, and at the very top it's a little eye, and you take your thread and you manually thread. Most providers do not use this. I will tell you right now. They mostly use the swag needle. All right, so A is curved, and then we have straight. In 20 years, I've never had to deal with straight needles. I've always done curved and swagged needles. All right, my favorite thing to do, insertion of sutures. Any questions up to this point? Okay. The medical assistant may be responsible for preparing the suture tray and for assisting the physician during the insertion of sutures. The physician designates the size and type of suture material and needle required. Because sutures, needles, and suture needle combinations, swagged needles, are contained in peel-apart packages, they can be added to the sterile field by flipping them onto the sterile field or by placing them there with a sterile gloved hand. Figure 10.10. Suture insertion setup. The items required for a suture insertion setup are listed next. Items placed to the side of the sterile field: clean disposable gloves, antiseptic solution, surgical scrub brush, antiseptic swabs, sterile gloves, local anesthetic, and antiseptic wipes to cleanse the vial, tetanus toxoid with needle and syringe, Items include on the sterile field: fenestrated drape, syringe and needle for drawing up local anesthetic, hemostatic forceps, thumb forceps, tissue forceps, dissecting scissors, operating scissors, needle holder, suture, and sterile 4x4 gauze. For suture insertion, a local anesthetic is used to numb the area. The physician inserts sutures to close a surgical incision or to repair an accidental wound. A sterile dressing may be applied to the operative site. Post-operative instructions: keep the dressing clean and dry. Contact the medical office if any signs of infection occur at the incision site, including excessive redness, swelling, discharge, or increase in pain. Notify the medical office if the suture becomes loose or break. Provide the patient with written instructions on wound care to refer to at home, and instruct the patient when to return for removal of the sutures. All right, any questions on that? All right. So some doctors may teach you on actually putting in these sutures. Dermatologists, this was something that I did quite often for my surgeons in dermatology. We would perform the procedure and the provider would go ahead and leave, and I would finish applying the sutures to the patient and give them the post-operative care. It's pretty fun. All right, suture removal. When the wound has healed such that it no longer needs the support of non-observable suture material, the sutures may be removed. The length of time the sutures remain in place depends on their location and the amount of healing that must occur. Some areas of the body, such as the head and neck, have a good blood supply. The sutures do not need to remain there as long as they do in other areas because this area heals more rapidly. Sutures must always be left in place long enough for proper healing to occur. Highlight the following. The physician determines the length of time, but in general, skin sutures inserted in the face and neck are removed in 3 to 5 days, and sutures inserted in other areas, such as the skin of the chest, arms, legs, hands, and feet, are removed in 7 to 14 days. All right, surgical skin staples. Surgical skin staples are often used to close wounds. Highlight stapling is the fastest method of closure of long skin incisions. In addition, trauma to the tissue is reduced because the tissue does not have to be handled much when the staples are inserted. Surgical staples are stainless steel and are inserted into the skin using a special skin stapler. Skin staplers are available as reusable or disposable devices. The skin stapler holds a cartridge that contains a prescribed number and size of staples. The physician inserts the staples by gently approximating the tissues with tissue forceps. The skin stapler is held over the site and the staple is inserted into the skin. Skin stapling produces excellent cosmetic results, and the staples are easy to remove with a specially designed staple removal. The medical assistant is frequently responsible for removing sutures and staples. The procedure should be done only after the physician has given a written or verbal order to the medical assistant. Procedure 10.5 presents the method used to remove sutures and skin staples. All right, so we're finally at our case study number 1. Carrie Ventura brings her 6-year-old son, Corey, to the medical office. Corey got a new bike for his birthday and just learned how to ride it without training wheels. While going around a corner, he lost his balance and fell and cut his left knee. The incision is about 1.5 inches long. Corey is going to need sutures to approximate the wound. Miss Ventura is very upset and blames herself. She says that she should have been watching him more closely. Miss Ventura wants to know why steri strips can't be used to close the incision. She says that it would be a lot less painful for Corey than having stitches. When asked to sign the consent for treatment form for Corey, Miss Ventura says she does not want to sign the form until her husband has a chance to read it. She says that right now he is in Japan for 2 weeks on a business trip. All right, ladies, what would you do?
It's not her fault.
Yeah. Yeah, it's not her
Things
fault.
happen.
Yep, these things happen. All right, what else?
You can't use the steri strips because the wound is too deep.
That's right. Does everybody know what steri strips are?
Like butterfly band-aid.
Yeah, kind of. So you can buy steri strips over the counter like at Walgreens or CVS, and they may be called the butterfly band-aid. And it's basically helps support one side of a wound to the other side. It helps kind of close a middle gap, right? But if Corey has a 1.5 inch, so let's say this is 1 inch, so probably from here to here, gash on his knee, steri strips are not going to work. They're not going to give Corey enough support so the tissue underneath the wound can heal properly. So that's right. So steri strips may be used in addition to the sutures, but not by themselves. All right, very good. What else?
See if maybe the mom can send the information to her husband because, I mean, they can't really wait 2 weeks to do sutures on his wound.
Yep. Yeah. So, I mean, obviously, Corey needs treatment now. So, and the husband can't obviously fly in from Japan within minutes. So, the best way to do is to talk to Corey's mom, talk to Corey, go over the consent with him, and then ask Miss Ventura if there's any questions that she wants to talk to the provider about so we can go ahead and get this consent signed so we can treat Corey. Because again, neither medical assistant or provider can touch that patient without that consent signed. Very good. What else? Anything else? Okay. What about what not to do? Is there anything else that we would want to discuss?
Want to blame her because she blames herself.
That's right. Yeah, we don't want to say, well, Miss Ventura, you should have been watching your kid. No, we're not going to do that because God knows my kids have fallen numerous times and I'm sitting there watching them constantly. It just happens. So she already is feeling pressure, blaming herself naturally that some mothers may do. So again, we do not want to add that. We want to be caring and understanding for our patient. All right, very good, ladies. All right, let's see. Adhesive skin closures. I love this stuff too. Lily, go ahead and read the first paragraph, please.
Adhesive skin closures may be used for wound repair to approximate the edges of the laceration or incision. Skin closures consist of sterile hyperallergenic tape that is commercially available in a variety of widths and lengths and is strong enough to approximate a wound until healing occurs. Brand names for adhesive skin closures are Steri-Strip and Proxy-Strip.
Very good. So Steri-Strip 3M Corporation is a very, 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 very common use. All right, very good. Natalie, go and read the next paragraph, please.
Adhesive skin closures may be used when not much tension exists on the skin edges. The strips of tape are applied transversely across the line of incision to approximate the skin edges. The advantages of adhesive skin closures are that they eliminate the need for sutures and have a local anesthetic. They are easy to apply and remove. They have a lower incidence of wound infection compared with sutures, and they result in less scarring than sutures. The, the disadvantage of this method is that there is less precision in bringing the wound edges together compared with sutures. In addition, adhesive skin closures cannot be used on certain areas of the body where the adhesive has difficulty adhering to the skin. This includes areas that harbor moisture. Examples: palm of the hand, soles of the feet, axillae, and heavy areas of the body, the scalp, a man's chest.
All right, very good. So I want you ladies to highlight where it says the advantages of adhesive skin closures are that they eliminate the need for sutures and local anesthetic. They are easy to apply and remove. They have a lower incident of wound infection compared with sutures, and they result in less scarring than sutures. All right, Sabrina, go ahead and read the next paragraph, please.
The medical assistant frequently is responsible for applying adhesive skin closures. Procedure 10.6 outlines this procedure. Approximately 5 to 10 days after application, the skin closures usually loosen and fall off on their own. If they require removal by the medical assistant, the method presented at the end of the procedure 10.6 should be followed.
Very good. Okay, you're just going to highlight where it says approximately 5 to 10 days after application. The skin closures usually loosen or fall off on their own. All right, I want you guys to turn to page 347. Tray setup. Assisting with minor office surgery requires a thorough knowledge of the instruments and supplies for each tray setup and the type of assistance required by the physician during the surgery. Highlight that sentence. The medical assistant must be able to work quickly and efficiently and to anticipate the physician's needs. The instruments and supplies for the surgery must be set on a sterile field. Many offices maintain index cards indicating the appropriate instruments and supplies for each minor office surgery tray setup. The card also may include information regarding the type of skin preparation, the position of patient, the physician's glove size, the type of suture material, preoperative instruction, and postoperative instructions. In general, the index cards are kept in a file box and are filed alphabetically by the type of surgery. The medical assistant should pull the card before setting up for the minor office surgery and use it as a guide to ensure that all required articles are placed on the sterile field. The medical assistant may set up the sterile tray before or after preparing the patient's skin. The sterile tray setup must not be contaminated. If the medical assistant must turn away from the sterile tray or leave the room after setting up, a sterile towel must be placed over the tray to maintain sterility. Methods used to set up a sterile tray. A common method used to set up a sterile tray is the use of pre-packaged sterile setups wrapped in disposable sterilization paper or muslin that are prepared by the medical office through autoclave sterilization. See Procedure 10.2. These setups are labeled according to use, for example, suture pack, cyst removal pack, and contain most of the instruments and supplies required for the minor office surgery indicated on the label. The medical assistant opens the wrapped package on a flat surface, such as a Mayo tray. Highlight a Mayo tray is a broad, flat metal tray placed on a stand that can be used to hold sterile instruments and supplies. The inside of the wrapped package is sterile and serves as a sterile field. Several additional articles not contaminated in the pre-packaged setup, for example, antiseptic, sterile 4x4 gauze pads, disposable syringes and needles, sutures, may need to be added to the sterile field when the package is opened. Items in peel-apart packages are added by flipping them onto the sterile field or by placing them on the field using a sterile gloved hand. If an antiseptic solution is poured into a basin, which is your bowl, on the sterile field, this is performed according to procedure 10.3. Another method used to set up a sterile tray is to place all necessary articles on the sterile field by flipping them onto the sterile field from peel-apart packages. With this method, the sterile field is prepared by placing a sterile towel over the tray, such as a Mayo tray, or another flat surface. The sterile towel must be handled by the corners only so as not to contaminate it. It must not be fanned through the air, but instead must be laid down gently and slowly to prevent airborne contamination. All right, any questions up to this point? You're doing good. We're officially halfway through. All right. Side table. Highlight the first sentence. Some articles required for minor office surgery are not placed on the sterile field, but are set on an adjacent table or counter. These articles, such as a surgical scrub brush, are not sterile and must not be placed on the sterile field. The local anesthetic, which is a sterile solution, is in a vial that is not sterile and must not be placed on the sterile field. The physician needs to apply gloves to perform the surgery. Although the gloves are sterile, the outside wrapper is not. The package of gloves must not be placed on the sterile field. In addition, it is easier for the physician to apply gloves from a side table or counter. To facilitate application of the gloves, the medical assistant opens the outside wrapper for the physician. So your sterile gloves come in one container and then wrapped in a plastic container. Okay, if I'm setting up my physician's area for their surgery, I am going to go ahead and undo that plastic, and I'm going to put those gloves on the counter. And then at that point, right before my provider puts on the gloves, I'm going to open the wrapper. And at that point, I'm not touching anything else because my physician's already washed his hands or her hands and dried them. And then now it's ready to be placed, the gloves can be placed on without contaminating it. All right, skin preparation. The patient's skin must be prepped before the minor office surgery because the skin contains an abundance of microorganisms. If these microorganisms were to enter the body through the operative site, a wound infection could develop. It is impossible to sterilize skin because chemical agents required to kill all living microorganisms are too strong to be placed on skin surfaces. The operative site and areas surrounding it must be cleaned and prepared in such a way as to remove as many microorganisms as possible to reduce the risk of surgical contamination. Okay, I want everybody to get a sheet of paper and a pen. Because we're about to go over this, but I want you ladies to go ahead and do this. Okay, so if this is my surgery site, well, it's kind of hard to see. All right, so this is where my physician needs to open, okay, on the skin. So I need to clean this, right? Skin preparation. So the way you clean it is you go from inside to outside, which means with my antiseptic solution and my gauze, I'm going to wipe in this circular motion. Okay? So I'm going to go from in, and I'm going to gradually make my surface wider until I clean the surrounding area without recontaminating what I just cleaned. So I want you guys to start practicing that, because even as you do injections, you're going to wipe your alcohol wipe the same way. Blood draws, same thing. All right, any questions on that? All right, shaving the site. Highlight this first sentence. Hair supports the growth of microorganisms, and the physician may want the medical assistant to shave the skin and around the operative site. Shave preparation trays are commercially available and include several gauze sponges, a measured amount of antiseptic soap, a container for soapy water, and a disposable safety razor. The skin should be pulled taut as it is shaved, and the medical assistant must be careful to prevent nicks. When all the hair has been removed, the shaved area should be rinsed and dried thoroughly. Cleansing the site. I want you ladies to highlight the first sentence. The operative site must be cleaned with an antiseptic solution such as provoiodine, betadine surgical scrub, or chlorhexidine gluconate, Hibiclens. The medical assistant should scrub the operative area with a surgical scrub brush using a firm circular motion moving from the inside outward. The area is rinsed using gauze pads saturated with water and is blotted dry with a sterile gauze. All right, any questions so far? Antiseptic application. When the patient's skin has been shaved off, if required, and cleansed, an antiseptic is applied to the operative area, followed by the application of a sterile drape. The antiseptic decreases the number of microorganisms on the patient's skin. A common antiseptic is betadine, and Hibiclens. Highlight a disposable sterile fenestrated drape, figure 10.14, is a type of drape most commonly used. Highlight it has an opening that is placed directly over the operative site. A fenestrated drape covers a wide area of the skin around the operative area, leaving only the operative site exposed. This provides a sterile area around the operative site and decreases contamination of the patient's surgical wound. All right, Talia, go ahead and read the first paragraph for local anesthetic.
Minor office surgeries often requires the use of local anesthetics. The local anesthetic most frequently used in the medical office is Lysodine hydrochloride. The physician injects the local anesthetic into the tissue surrounding the operative site, a process termed infiltration to produce a loss of sensation in the area and prevent the patient from feeling pain during the surgery. When the first injection into the tissue, Lysodine causes the patient to experience a brief burning or stinging sensation at the injection site. The local anesthetic begins working in 5 to 15 minutes and has a duration of actions of 1 to 3 hours, depending on the type of anesthetic.
Very good, thank you. All right, I want you ladies to highlight the physician injects the local anesthetic into the tissue surrounding the operative site, a process termed infiltration, to produce a loss of sensation in that area and prevent the patient from feeling pain during the surgery. Also highlight that when first injected into the tissues, lidocaine causes the patient to experience a brief burning or stinging sensation at the injection site. Also highlight local anesthetic begins working in 5 to 15 minutes and has a duration of action of 1 to 3 hours depending on the type of anesthetic. So It does cause some burning. Most providers may teach you to actually apply the local anesthetic. And right before I numb my patients, I always tell them you are going to feel a little bit of burning, but it should be very short lasting. The medicine goes into effect pretty quick. All right, some physicians prefer to use a local anesthetic containing epinephrine. Highlight: epinephrine is a vasoconstrictor that prolongs the local effect of the anesthetic and decreases the rate of systemic absorption of the local anesthetic. Highlight: it accomplishes this by constricting blood vessels at the operating site. The physician informs the medical office of the type, strength, and the amount of local anesthetic needed for the minor office surgery. Xylocaine is available in 0.5%, 1%, 1.5%, and 2% solutions. The physician may order 1 ml of xylocaine 2% with epinephrine to suture a laceration of the forearm. All right, let's see. Alicia, go ahead and read the first paragraph for preparing the anesthetic.
The local anesthetic is drawn up into the syringe according to the procedure presented in Chapter 11. The vial must first be cleaned using an antiseptic wipe. The correct amount of anesthetic solution is withdrawn into the syringe. This may be performed by the medical assistant or the physician. The medical assistant withdraws the anesthetic into the syringe and hands it to the physician, who has not yet applied sterile gloves. The physician injects the anesthetic into the patient's tissue and then applies sterile gloves to begin the surgery.
Very good. Anna, go ahead and read the next paragraph.
The physician may prefer to draw the anesthetic solution in syringe after he or she has applied the sterile gloves. The medical assistant should first show the label of the vial to the physician and should then hold the vial securely while the physician withdraws the medication. Figure 10.15. The medical assistant must hold the vial because the outside of the vial is medically unaccepted and cannot be touched by the physician sterilized glove hand.
All right, very good. Lily, go ahead and read the first paragraph under assisting the physician.
The type of assistance required by the physician during a minor office surgery is based on the type of surgery and the physician's preference. Some physicians want the medical assistant to apply sterile gloves and assist directly by handing instruments and supply from the sterile field. An instrument should be handed to the physician in a firm, confident manner so the instrument does not slip out of the physician's hand and drop on the floor. The instrument should be placed in the physician's hand in its functional position, that is, the position in which it is used. Figure 10.16 is if the instrument is handed correctly, the physician should not have to reposition the instrument to use it.
All right, very good. Natalie, go ahead and read the next paragraph, please.
The medical assistant is responsible for adding any instruments or supplies to the sterile field that the physician requires after the surgery has begun, such as another hemostat, additional 4x4 gauze pads, and sutures. This is usually accomplished by using peel-apart packages and either flipping the contents onto the sterile field or holding the package open and allowing the physician to remove the contents with the gloved hand. In assisting with minor office surgery, it is essential to know all steps in the procedure so that the physician's needs can be anticipated and the surgery proceeds smoothly and efficiently.
All right, very good. Sabrina, go ahead and read the next paragraph, please.
The physician may obtain a tissue specimen that is sent to the laboratory for histologic examination. The specimen must be placed in an appropriate size container with the preservative. The medical assistant is responsible for labeling the specimen container. An unlabeled specimen is cause for rejection rejection of the specimen by an outside laboratory. 2 unique identifiers should be used to label the specimen. A unique identifier is information that clearly identifies specific patient, such as the patient's name and date of birth. A specimen can be labeled by attaching a computerized barcode label to the specimen. A specimen can also be labeled by handwriting the information on the label, which should include the patient's name, date of birth, and date and time of the collection, the medical assistant's initials, and any other information required by the laboratory, such as the source of the specimen. The information should be printed legibly, and medical assistants should be certain that the information is accurate to avoid a mix-up of specimens. The medical assistant also must complete a laboratory requisition to accompany the specimen. This is known as biopsy requisition.
All right, very good. Talia, go and read the next paragraph, please.
When the minor office surgery is completed, the physician may want the medical assistant to place a DSD over the surgical wound to protect it from contamination or injury or to observe drainage. The medical assistant also is responsible for assisting the patient in cleaning the examination room.
All right, very good. Alicia, go and read the next paragraph.
Procedure 10.7 describes the medical assistant's responsibilities while assisting with minor office surgeries. Specific instruments and supplies required for the minor office surgery depends on the type of surgery being performed and the physician's preference. Knowing the name and function of the surgical instruments shown in Figure 10.3 enables the medical assistant to set up for each type of minor surgery performed in the medical office. If the medical office uses prepackaged sterile setups, the medical assistant should have already assembled the instruments and supplies in the package during sanitization and sterilization process. However, the instruments and supplies should be checked after the pack is opened to ensure that all sterile articles are included.
Very good. Okay, I want you ladies to quickly look at figure 10.16. So if you are assisting your provider in a procedure, this is how you will hand all instruments to him if you are the one that is handing the instruments. All right, any questions on any of that? All right. Case study number 2. Abby Mindy is having a sebaceous cyst removed from her neck. She wants to know why the antiseptic applied to her neck is orange and whether it's going to stain her skin permanently. During the procedure, Abby reaches her hand up to adjust her hair and accidentally touches the physician's gloved hand. After the procedure, a sterile dressing is applied to her neck and she is given an appointment to return to have her sutures removed. Abby becomes alarmed when she is told that the cyst will be sent to the laboratory for a biopsy. She wants to know whether the physician is not telling her everything about her condition, and she is concerned that maybe he thinks she has cancer. Abby asks if her neighbor can take out her sutures. She says that she has worked as a veterinary assistant for the past 8 years and has lots of experience in removing sutures. Okay, so this one actually is a pretty common one. All right, medical assistants, what do we do?
We let her know that the betadine, it just has an orange tint, but it's not gonna stain her skin.
That's right. What antiseptic solution is that they're referring to?
Betadine.
Betadine. That's right. Very good. All right, good. What else do we do?
So she reaches up and touches her accidentally, so she'll have to remove her gloves and re-sterilize.
Yeah. Yep. Yep. So just nice, calmly, discreetly go and open up a new sterile. Have you or your provider change the gloves. Not a big deal. It happens. All right. Very good. Anything else?
Tell her that her cyst being sent to the laboratory is just a precaution that they're taking. Nothing, not saying anything's wrong, but just to make sure.
Yep.
And tell her that her neighbor should absolutely not take her sutures out because she's a vet.
That's right. So it is really common for people to want to have other people take out their sutures because they don't want to have to come back. So, yes, I mean, they can, but we really need to stress to the patient that the provider really needs to take a look at the surgical incision and make sure that it's healing well, because the sutures may need to stay in for a little bit longer. And then again, that's right, we're going to reassure the patient, nothing to be alarmed about. It's just a normal process that we do. We send off all of our specimens to the lab. Nothing to be concerned about. All right. Is there anything else that we would do or what we would not do?
Tell her that she has cancer.
Yes. Yes. Yeah. Never tell a patient that. Very good. All right. Anything else?
You don't want to come off rude when she asks if her neighbor can take out the stitches. You just kind of want to just be more, how do I put it? You just want to be more, I want to say like rude or make her feel dumb, because like that's like a dumb question, but
Right. Yeah. I mean, technically, yeah. I mean, yeah, exactly. So it's not a dumb question. So we just want to make sure, we, tell her that's a really good question. I'm glad you asked. I'm sorry, y'all. My dog is going 8 nuts here on the bed. That's a really good question. We're glad you asked, and then provide her with the information. All right, very good. Any other ideas or thoughts on case study number 2 or anything that we've read up to this point? All right. Now I want everybody to turn to page 356. Now comes the really fun part. I'm so excited. I love this chapter. All right, medical office surgical procedures. The most common surgical procedures performed in the medical office are presented on the following pages. A discussion of the procedure and the items required for each tray setup are included. The medical assistant should take into account, however, that the instruments and supplies may vary slightly from those listed here, based on the physician's preference. Super common, sebaceous cyst removal. Go ahead and highlight the first sentence. A sebaceous cyst, also known as an epidermal cyst, is a thin, closed sac or capsule located just underneath the surface of the skin. A sebaceous cyst forms when the outlet of a sebaceous oil gland becomes obstructed. The cyst contains sebum, which is made up of secretions from the sebaceous gland. The built-up secretion of sebum causes swelling, and the lining of the sac consists of the stretched sebaceous gland. A sebaceous cyst is usually white or yellow in appearance and varies in size from less than a 1/4 inch in diameter to nearly 2 inches in diameter. I've seen them larger. It is usually movable, dome-shaped mass with a smooth surface that is filled with a thick, fatty, white, cheesy material that has a foul odor. That is so true. Highlight, this type of cyst can occur anywhere on the body except on the palms of the hands and the soles of the feet. These areas do not contain sebaceous glands. Sebaceous cysts tend to occur more frequently on the scalp, face, ears, neck, back, and genital area. A sebaceous cyst is usually slow growing, painless, and non-tender and may disappear on its own. A sebaceous cyst usually does not require surgical removal unless it becomes infected. An infected cyst is painful, tender, red, and swollen, and may have a grayish white, foul-smelling discharge. Highlight, because it is difficult to remove an infected sebaceous cyst, the physician usually drains the cyst and allows it to heal, and then performs the cyst excision at a later time. Other reasons for removing a sebaceous cyst include cosmetic concerns and the need to reduce discomfort from the cyst that is located in a body area that is easily irritated, such as the armpit. Surgical excision of a sebaceous cyst is a simple procedure that involves complete removal of the sac wall and its contents. Most sebaceous cysts are benign and are not usually biopsied unless they have an unusual appearance that may indicate a more serious problem. The side tray setup includes the items needed for a tissue biopsy, a specimen container, and laboratory request form. However, these items will not be placed on the tray if the physician determines that a biopsy of a sebaceous cyst is not warranted. A sebaceous cyst setup. Items placed to the side of the sterile field. Lily, go ahead and read those items, please.
Fenestrate, needle and syringe for drawing up the local anesthetic, scalpel and blade, disinfecting scissors, hemostatic forceps, tissue forceps, thumb forceps, operating scissors, needle holder, stitchers, and sterile 4x4 gauze.
All right, very good. Natalie, go ahead and read the next paragraph, please.
A sebaceous cyst is removed as follows. A local anesthetic is used to numb the area. The physician makes an incision using either a single cut down the center or an oval cut on both sides of the cyst. The physician then removes the cyst and sutures the surgical incision. Figure 10.19. If the cyst is to be biopsied, it is placed in a specimen container with a preservative and sent to the laboratory for examination by a pathologist. A sterile dressing is applied to the operative site.
All right, very good. So figure 10.19, that is the most commonly way that a provider will make the surgical incision, which is almost like a football, right? It's just kind of oval on each sides. That's a very common incision. All right, Sabrina, go ahead and read the next postoperative instructions, sebaceous cyst removal.
Post-operative instructions include the following: keep the dressing clean and dry. Report any signs that the wound is infected, which include fever, increased pain, swelling, redness, warmth, and discharge. Notify the medical office if the if the sutures become loose or break. Provide the patient with written instructions on wound care to refer to at home, and instruct the patient to return for the removal of the sutures.
All right, very good. I think my dog is barking at your dog, Sabrina. Sorry about that. Okay, very good. So a sebaceous cyst is a very common procedure done in your medical office, whether it's your primary care office, a dermatologist, a general surgeon's office. It's very common. Now, when it comes to numbing an infected sebaceous cyst, it is very painful for the patient. So just go ahead and make a note of that. All right, surgical incision and drainage of localized infection. Highlight, an abscess is a collection of pus in a cavity surrounded by inflamed tissue. It is caused by a pathogen that invades the tissue, usually via a break in the skin. An abscess serves as a defense mechanism of the body to keep an infection localized by welling off the microorganisms, preventing them from spreading through the body. A furnicle, also known as a boil, is a localized staphylococcal infection that originates deep within a hair follicle. I like that sentence. Furnicles produce pain and itching. The skin initially becomes red and then turns white and necrotic over the top of the furnicle. Arrhythmia and induration usually surround it. All right, so let's go ahead and take a look at figure 1020. A is the staphylococcal skin abscess. B, an abscess is a collection of pus in a cavity surrounded by inflamed tissue. All right, so that's what it looks like on top, and then that's what it looks like under the layers of the skin. All right, any questions about anything so far, ladies? You guys are doing really good. All right, incision and drainage setup. I'm not going to have you read these items, but I do want you to go ahead and look under the procedure, incision, and drainage on page 358. And on number 2, highlight where it says either gauze packing or a rubber Penrose drain is inserted into the wound to keep the edges of the tissue apart. This facilitates drainage of the exudate. So what they're talking about, so anytime you remove a boil, because of the way the skin, usually on your top layer of skin, so this skin right here, it heals faster than the skin underneath it. So when you are surgically taking care of a boil, sometimes, and well, most times, you have to actually keep that the sac of the boil, keep that tissue opened. So it actually heals from the inside out instead of the outside in. Because if it heals from the outside in, guess what's going to happen? The boil is just going to come back. So gauze packing is a common item that you will use to place inside that wound, and it keeps it open. And sometimes the gauze is, it already is sterilized, and then sometimes it's sterilized in iodine, so it'll be up to your provider's preference. All right, mole removal. Oh, I'm so excited. Okay. Talia, read the first paragraph, please, for mole removal.
A mole, also known as a nubeus, is a small growth on the human skin. An individual may be born with moles, which are known as congenital nuvi, but may develop moles over time, known as acquired nuvi. According to the American Academy of Dermatology, the majority of moles appear during the first 20 years of an individual's life. Moles can occur anywhere on the skin, and between 10 to 40 moles on the body is considered normal. Larger numbers of moles can be concentrated on the back, chest, and arms. Most moles are benign and exhibit the following characteristics.
All right, very good. So I want you ladies to highlight that a mole, also known as a nevus, is a small growth on the human skin. Highlight an individual may be born with moles, which are known as congenital nevi, but may develop moles over time, known as acquired nevi. All right, so on the first bullet point, highlight usually range in color from brown to nearly black, but can be a pinkish flesh color to dark blue or even black. Dark colored moles consist of a cluster of melanocytes. Highlight melanocytes produce the pigment melanin, which is responsible for the dark color of moles. Shape is usually round or oval, highlight that. It may be smooth or rough. Size is usually smaller than a pencil eraser, highlight that, but can range from barely visible to quite a large area. May form a raised area on the skin or may be flat, highlight that. May sometimes have hairs growing out of them. The most common types of moles are skin tags, flat moles, and raised moles. Skin tags, or acronodon, are small, painless, benign growths that project from the skin from small, narrow stalk, known as a peduncle. Highlight those two sentences. They are flesh-colored or slightly darker, often appear in groups, and range from 1 millimeter to 5 millimeters in size. Skin tags occur most often during and after middle age in adults who are overweight or have diabetes. Skin tags are most frequently found in body areas where the skin creases, such as the eyelids, neck, armpits, upper chest, and groin. And occasionally, a skin tag becomes irritated as a result of shaving or rubbing from clothing or jewelry. A flat mole is any dark spot or irregularity in the skin. A raised mole, as the name applies, and extends above the skin. It can be a variety of colors and runs deeper than flat moles. Although most moles are benign, some moles may be precancerous or known as dysplastic nevi. Highlight that. Highlight dysplastic nevi are usually larger than normal moles and have an irregular coloration and shape. Highlight the center of the dysplastic nevi may be raised and darkened. According to the National Care Institute, dysplastic nevi are more likely than ordinary moles to develop into malignant melanoma. Highlight that sentence. Because of this, dysplastic nevi are often biopsied or removed and biopsied to determine whether they are malignant. Melanoma is a very serious type of skin cancer that can sometimes develop within a mole. Melanoma is most apt to be found on the upper backs of men and on the lower legs of women. Studies show that excessive sun exposure, especially severe blistering sunburns early in life, increases the risk of developing certain melanomas. If discovered early, it may be possible to completely remove the melanoma and reduce the spread of the cancer. Left untreated, melanoma can be fatal. All right, before we go any further, has anybody heard of the word melanoma? Does anybody have any family members that have been diagnosed with melanoma?
Yes.
What did they do for your family member?
She had one. It looked like one on her arm. Well, she's in Mexico. My cousin. And they said that it was early detected because she was like, it came out of nowhere, that mole, and they went to the hospital and they said that they removed it, like they removed that piece,
Very good.
and it just left her like a tiny scar.
Good. Good. So melanoma can be fatal. There's no other way about it. Melanoma can start being noticed in a mole and can spread throughout the entire body. So whether you work for a dermatologist, you work for a family physician, melanoma is very serious, and your providers may do skin checks for your patients, especially if they have a family history of melanoma and or they have sun damage.
I have a question.
Yes.
So what if you already have a mole? Like, one you were born with, can it turn into a melanoma? Can it turn into like a cancerous mole?
Not usually, no. No. Most moles, if you're born with them, which are the congenital nevi, they may grow in size or kind of look kind of weird, but generally, no. They generally don't turn into any precancerous or cancerous lesions. Now, if at any point you've noticed a change on yourself, on your family members, on your patients, a change in their moles, you recommend them getting it checked out.
Oh, because I have never had this mole before, but it just appeared on my pinky.
What color is it?
It's like really dark.
Is it a perfect circle?
It looks like it, yeah.
Okay. How big of a circle? Is it
It's
a
like it's as small as like the little ball of a ball.
um and do the borders of your mole, do they look perfectly circular or do they look kind of jagged?
Uh, it's like dark in the middle, and on the outside it's kind of like light.
Okay. So that I would love for you to go get that checked out.
It looks kind of perfectly circular, but it's probably because it's on like the crease of my finger.
Probably. So some moles, even though they look really weird, like they don't make a perfect circle, they're two different colors. Most times out of others, they are completely normal. But those type of moles can change sometimes, and you want to make sure you stay on top of it. So I always recommend you get a skin check once a year, whether by your family physician or a dermatologist.
Okay.
So I mean, I'm feel pretty positive that it's fine, but because it's two different colors, go get it checked out. All right. Any moles exhibiting the following characteristics common to melanoma should be evaluated by a physician. So asymmetric, one half of the mole is different than the other half. Irregular border, the edges of the mole are notched, uneven, or blurred rather than round or distinct. Color varies from one area of the mole to another. Various shades of tan, brown, and black, and sometimes white, red, or blue are present. Diameter in larger than a 1/4 inch, 6 millimeters, which is about the diameter of a pencil eraser. Other signs, the mole is painful or tender, itches, bleeds, oozes, or has a scaly appearance. So before we go on to page 360, figure 10.10, that's a common view for skin tags. Figure 10.23, raised moles. Those look pretty normal, but the patient may want them to be removed just because of where the one is on the eyebrow. And figure 10.24, dysplastic nevi. So the border is irregular and it's two different colors. All right, so now let's go on to page 360. All right, Natalie, I just responded to your message. Okay, so really quickly, let's look at figure 10.25. We have the ABCDs of melanoma. A for asymmetry, B for border, C for color, and D for diameter. Moles are removed for a variety of reasons, which include cosmetic issues, to improve the individual's appearance and reduction of irritation and discomfort from the mole that is rubbing against clothing or that is in the way of when shaving. A more serious reason for removing a mole is that the mole is suspected of being precancerous, dysplastic nevus, or cancerous melanoma. Several methods may be used to remove the mole. The most common methods are a shave excision, surgical excision, and laser surgery. The method used depends on the type of mole being removed, including its size, shape, color, and location. In some cases, a biopsy of the mole is performed before the mole is removed to determine whether the mole is benign or malignant. All right, procedure, mole shave excision. It's very commonly done in dermatologists and some primary care doctor's office. I want you to highlight the first sentence. The shave excision is the most commonly used to remove protruding moles. It can also be used to remove skin tags. All right, and on page 361, I want you ladies to go ahead and under laser mole surgery, I want you to highlight that first sentence. All right, under needle biopsy. Highlight, a biopsy is the removal and examination of tissue from the living body. The tissue usually is examined under a microscope. Biopsies are most often performed to determine whether a tumor is malignant or benign. All right, now let's go on to page 362. Another fun procedure, ingrown toenail removal.
I've had one of those.
Was it fun to get removed?
No, it was really terrible. It was like my freshman year of college when I was running track, and yeah, it was terrible.
Ouch. Yeah, it's not pleasant to have it done, but it is really fun to do it. I've had one done too. All right, ingrown toenail removal. Let's see. Alicia, go ahead and read the first paragraph.
An ingrown toenail occurs when the edge of the toenail grows deeply into the nail groove and penetrates the surrounding skin, resulting in pain and discomfort. Figure 10.26a, an ingrown nail can occur in both sides of the nails and those of the feet. However, it is more apt to occur in the toenails. External pressure, such as from tight shoes or trauma, improper nail trimming, or infection, can cause the ingrown toenail. The protruding nail acts as a foreign body, usually resulting in a secondary infection and inflammation. In mild cases, this condition is treated by inserting a small piece of cotton packing under the toenail to raise the nail edge away from the tissue of the nail groove. Figure 10.26b. In severe and recurring cases, part of the nail must be surgically removed. Figure 10.26c and d. Severe cases cause pain, swelling, redness, and drainage. The toenail removal procedure relieves pain by decreasing nail pressure on the soft tissues.
All right, very good. So I want you guys to highlight where it says external pressure, such as from tight shoes or trauma, improper nail trimming, or infection can cause an ingrown toenail. All right. Let's go on to page 363 for post-operative instructions on the ingrown toenail. I want you ladies to highlight 1, 2, 3, 4, 5, and 6. And just like medical assistants can apply local anesthetic or anesthesia, you can also numb toenails, toes. So the options are endless. All right, colposcopy. Anna, go ahead and read the first paragraph, please.
Coloscopy is the visual examination of the vagina and the cervix by means of a lighting instrument by a binocular magnifying lens known as a coloscope. The purpose of a colonoscopy is to examine the vagina and cervix to detect areas of any abnormal tissue growth that may not be visible of the naked eye. Figure 10.29. The
Colposcopy.
it sounds like colonoscopy, so I'm getting
It
it
does,
confused.
but I would not recommend prescribing a colonoscopy when you should be doing a colposcopy. The patient is not going to be happy.
A coloscopy is performed after an abnormal Pap test results and is evaluated a vaginal or cervical lesion observed during a pelvic examination. The primary goal of a colposcopy is to prevent cervical cancer by detecting precancerous lesions early and detecting them and treating them.
Very good. Thank you. Okay, so I want you ladies to highlight that very first part where a colposcopy is the visual examination of the vagina and cervix by means of a lighted instrument with a binocular magnifying lens known as a colposcope. Also highlight that a colposcopy is performed after an abnormal Pap test results and to evaluate vaginal or cervical lesion observed during a pelvic examination. All right, Lily, go and read the next paragraph, please.
Blood cells make it more difficult for the physician to observe the cervix. Therefore, a coloscopy is usually performed 1 week after the end of the menstrual period. To prepare for the procedure, the patient should be told not to use tampons, vaginal medications, or spermicides, or have intercourse for 24 hours before the examination. The lens of the coloscope is positioned approximately 12 inches from the opening of the vagina. The lens magnifies tissues, facilitating the inspection of cervical cells and obtaining of the biopsy specimen. For the routine coloscopic examination, a magnification ranging from 6 times to 15 times is typically used. The coloscope may be placed on an adjustable stand or attached to the side of the examining table and swung out before use.
All right, very good. Natalie, go ahead and read colposcopy setup.
The items required for colposcopy are listed. Items placed to the side of the sterile field: colposcope, sterile gloves, normal saline, acetic acid 3%, Lugol's iodine solution. Items included on the sterile field: vaginal speculum, long sterile cotton-tipped applicators, uterine tenaculum, uterine dressing forceps.
All right, very good. So for the procedure colposcopy, I want you ladies to highlight number 1 and number 5. Cervical punch biopsy. A cervical biopsy is performed in combination with a colposcopy to remove a cervical tissue specimen for examination by a pathologist. The purpose of the biopsy is to detect the presence of cervical dysplasia or cancer of the cervix. Highlight those two sentences. Cervical dysplasia is an abnormal growth of cells on the surface of the cervix that are precancerous. Precancerous means that abnormal cells have the potential to develop into cancer in the future. Cervical dysplasia can range from mild to moderate to severe. A cervical punch biopsy can also be used to diagnose polyps on the cervix and genital warts. Genital warts may indicate infection with the human papillomavirus, HPV, which is a risk factor for developing cervical cancer. Performing a cervical punch biopsy helps the physician to determine the amount of or the type of abnormal tissue present on the cervix so that the physician can determine the best form of treatment for the patient's condition. Cervical biopsies are most frequently performed after abnormal Pap test results. Although an abnormal Pap test result is a cause for concern, the majority of abnormal Pap test results are not caused by cervical cancer, but rather by a vaginal infection. To prevent inaccurate test results, the cervical biopsy is usually performed 1 week after the end of the menstrual period, when the cervix is the least vascular. To prepare for the procedure, the patient should be told not to douche, use tampons, vaginal medications, or spermicide, or have intercourse for 24 hours before the procedure to prevent inaccurate test results. All right, case study number 3. Sadira Weissall has been referred to the office by her family physician for a colposcopy. Her last Pap test results came back as abnormal, and a repeat Pap test 3 months later also had abnormal results. While having her vital signs taken, Sandra burst into tears. She tearfully explains that she's afraid that she has cancer and that no one at her regular physician's office told her what to expect from this procedure. Sadria does not understand why she has to have this procedure done, and she does not know what the physician will be doing during the procedure. She says that she feels stupid, but she does not even know what a cervix is. Sandira also worries that a procedure will affect her ability to have children. All right, ladies, whether you are in your family physician or an OBGYN, this case study is very, very common. So let's go ahead and discuss it.
I think that we should comfort her, make her feel comfortable. Sometimes at a gynecologist office or wherever she's getting this done, they'll have like a little, little diagram, or not the diagram, but the little like 3D. You can show her exactly what you're going to be doing and show her, or what the physician's going to be doing, and show her what the cervix is, explain to her what the procedure, what's going to happen. I mean, just reassure her, calm her down.
Yeah. That's right. So make use of your office resources. So some offices, they have the little models of body diagrams, whether it's a ovaries or cervix or lungs. Take advantage of all that when you're explaining a procedure to the patient. So the one thing is that she doesn't know why she's having to have this procedure, right? So how do we answer that question?
You could just explain to her that since her Pap test came back abnormal twice already, that they just want to look in there and make sure everything looks good and just get more information.
That's right. All right. Is there anything else that we want to tell her on what we would do? All right. What about not to do?
I don't want to judge her or make her feel uncomfortable because she already does.
That's right. All right. Have any of you ladies? Go ahead.
Make her not. You know how some patients feel they feel embarrassed because they don't know what certain parts of the body is. How she said she didn't know what the cervix was. So just make her feel, comfortable that it's okay to not know what it was.
Yeah. Yeah, that exactly. So it's normal for anybody who has no idea of medically anything to not what body parts they really have, right? So yeah, I mean give her a quick anatomy. You know, what is a cervix? Well, all right, well this is what it does. Very good. All right, has anybody ever heard of a colposcopy until now?
I haven't.
All right. All right, so let me ask this. Yeah, okay, so some of you have it, and that's okay. You will become more familiar with these type of testing as you are getting into the field. Now, the question on what we do not want to do, what is the one major thing that I'm looking for that we do not want to inform our patient?
That she has cancer?
Yes. Yes. At 17 years old, my medical assistant told me we're getting this done because I have cancer. And you try explaining that to a young patient, what do you think is going to happen?
They're gonna freak out.
That's right. That's right. So these patients are coming into you just like with all of our case study. We've got to make sure that we don't diagnose them with anything. That is not our job, but we are there to make sure they know that we're there for them. All right, very good. Any other questions or comments on that case study? All right, so let's look on page 365, figure 10.30. A Kevorkian punch tip with a universal handle or a Whitner punch tip is used for cervical punch biopsies. Under postoperative instructions for cervical punch biopsies, please highlight number 3. All right, cryosurgery. Cervical cryosurgery. Cervical cryosurgery, also known as cryotherapy, uses freezing temperatures to treat certain gynecologic conditions. Cryosurgery is most often performed as a treatment for cervical dysplasia to destroy abnormal cervical cells that show changes that may lead to cancer. Highlight those last 2 sentences. Cryosurgery is done only after a colposcopy confirms the presence of cervical dysplasia. Cryosurgery is also used for the treatment of chronic cervicitis, which is the inflammation of the cervix. Cervical cryosurgery can be performed without anesthetic, although occasionally a mild analgesic is necessary immediately afterward. The cryosurgery unit consists of long metal cryoprobe attached to a cooling agent tank. The principal cooling agents are liquid nitrogen and compressed nitrogen gas. The cryoprobe is inserted into the vagina and placed firmly in contact with the abnormal area. The cooling agent flows through the cryoprobe, freezing the cervical tissue at -20 degrees Celsius. This causes the abnormal cells to die and slough off so that the cervical covering can eventually be replaced with new, healthy epithelial tissue. Regeneration of cervical tissue occurs approximately 4 to 6 weeks after the procedure. After cryosurgery, the patient will be required to have a Pap test every 3 to 6 months for a period of time determined by the physician. All right, so for the postoperative instructions, cervical cryosurgery, please highlight number 4. Skin lesions. In the medical office, cryosurgery also may be used to remove benign skin lesions such as common warts and skin tags. Highlight that sentence. Only a small amount of cooling agent is required for the skin lesions, so the cryosurgery unit is considerably smaller than the one described for cervical cryosurgery. Most physicians use liquid nitrogen contained in a small, pressurized stainless steel canister with an attached probe. The physician applies the liquid nitrogen to the skin lesion until it turns white, which indicates that freezing of the tissue has occurred. During the procedure, the patient feels a slight burning or stinging sensation as a cooling agent is applied. After cryosurgery, a blister develops and dries to a scab in 1 week to 10 days and eventually sloughs off. The patient should be told to keep the area clean and dry until the scab has sloughed off. In some cases, the treatment may not result in complete destruction of the lesion. 2 or more treatments may be required to remove the lesion. So cryosurgery is something on skin lesions that a medical assistant also may be trained to do. It's pretty fun. All right, last but not least for chapter 10, we have bandaging. A bandage is a strip of woven material used to wrap or cover a part of the body. The function of the bandage may be to apply pressure to control bleeding, to protect a wound for contamination, to hold a dressing in place, or to protect, support, or immobilize an injured part of the body. Highlight that last sentence. All right, guidelines for application. Talia, go ahead and read 1 through 3.
Observe the principle or medical aspects during the application of a bandage. Ensure that the area to which a bandage is applied clean and dry. Do not apply a bandage directly over an open wound. To prevent contamination of the wound, first apply a sterile dressing, then debandage. The bandage should extend at least 2 inches, 5 centimeters beyond the edge of the dressing.
Very good. Okay, so I just want you ladies to highlight the first sentence on number 3. All right, Alicia, go ahead and read 4, 5, and 6.
To prevent irritation, do not allow the skin surfaces of 2 body parts, example 2 fingers, to touch. In addition, the patient's perspiration provides a moist environment that encourages the growth of microorganisms. A piece of gauze should be inserted between the 2 body parts. Ensure that joints and prominent parts of bones are padded to prevent the bandage from rubbing the skin and causing irritation. Bandage the body part in its normal position with joints slightly flexed to avoid muscle strain.
All right, very good. Anna, go ahead and read 7, 8, and 9.
Applying the bandages from the distance to the proximal part of the body to aid the venous return of blood to the heart. 8. As you apply the bandage, ask the patient whether it feels comfortable. The bandage should fit snugly enough that it does not fall off, but not too tight that it impedes the circulation. 9. If possible, leave the fingers and toes exposed with bandaging and extremely. This provides the opportunity to check them for signs of impairment in circulation. Signs indicating that the bandages is too tight include coldness, polar numbness, and cyanosis
Cyanosis.
cyanosis of the nail beds, swelling, pain, and tingling sensations. If any of these signs occurs, loosen the bandages immediately.
Very
If
good.
a band
Go ahead.
or read 10.
Yeah, that's fine. Go ahead.
Okay, 10. If a bandage roll is dropped during the procedure, obtain a new bandage and begin again.
Very good. All right, ladies, what is cyanosis? For those of you who are supposed to be studying your root words and abbreviations.
Blue.
Yes, blue.
Yes. Oh my God, I've been studying the crap out of them. Yes.
All right, good job, ladies. Good job. All right, types of bandages. Let's see, Lily, go ahead and read the first paragraph.
3 basic type of bandages are used in the medical office. A roller bandage is a long strip of soft material wound on itself to form a roll. It ranges from half an inch to 6 inches wide and from 2 to 5 yards long. The width used depends on the part being bandaged. Roller bandages usually are made of sterilized gauze. Gauze is porous and lightweight, molds easily to a body part, and is relatively inexpensive and easily disposed of. Because it is made of loosely woven cotton, however, it may slip very easily. Cling gauze is a special type of gauze that stretches. This allows it to cling, and as a result, it holds and confirms better to the body part than a regular gauze.
Very good. All right, Natalie, please read the second paragraph.
Elastic bandages are made of woven cotton that contains elastic fibers. One brand name of elastic bandages is the Ace bandage. Although elastic bandages are expensive, they can be washed and used again. The medical assistant must be extremely careful when applying an elastic bandage because it is easy to apply it too tightly and impede circulation. Elastic adhesive bandages also may be used. These have an adhesive backing to provide a secure fit.
All right, very good. All right, so bandage turns. 5 basic bandage turns are used alone or in combination. The type of turn used depends on which body part is being bandaged and whether the bandage is used for support or immobilization or for holding a dressing in place. First bullet point, the circular turn is applied to a part of uniform width such as toes, fingers, or the head. Each turn completely overlaps the previous turn. 2 circular turns are used to anchor a bandage at the beginning and the end of a spiral reverse, figure 8, or recurrent turn. Highlight where it says the circular turn, and then highlight 2 circular turns are used to anchor a bandage. All right, second bullet point, the spiral turn is applied to a part of uniform circumference, such as fingers, arms, legs, chest, or abdomen. Each spiral turn is carried upward at a slight angle and should overlap the previous turn by 1/2 to 2/3 the width of the bandage. Third bullet point, the spiral reverse turn is useful for bandaging a part that varies in width, such as the forearm or lower leg. Reversing each spiral turn allows for a smoother fit and prevents gaping caused by variation in the contour of the limb. The thumb is used to make the reverse halfway through each spiral turn. The bandage is directed downward and folded on itself while it is kept parallel to the lower edge of the previous turn. Each turn should overlap the previous one by 2/3 the width of the bandage. The reverse turn is used as often as necessary to provide a uniform fit. I want you ladies to highlight the first sentence on that one. My favorite, the figure 8 turn is used to hold a dressing in place or to support and immobilize an injured joint, such as the ankle, knee, elbow, or wrist. Highlight that sentence. The figure 8 turns consist of slanting turns that alternately ascend and descend around the part and cross over one another in the middle, resembling the figure 8. Each turn overlaps the previous one by 2/3 the width of the bandage. The recurrent turn is a series of back and forth turns used to bandage the tips of fingers or toes, the stump of an amputated extremity, or the head. The bandage is anchored by using 2 circular turns and is passed back and forth over the tip of the part to be bandaged. first on one side and then on the other side of the first center turn. Each turn should overlap the previous turn by 2/3 the width of the bandage. All right, any questions on that, ladies? All right, tubular gauze bandage. A tubular gauze bandage consists of seamless, elasticized gauze fabric dispensed on a roll. It is used to cover round body parts such as fingers, toes, arms, and legs, and it fits like a sleeve. This type of bandage is easier to apply than a roller bandage, and it adheres more securely to the body part. Tubular gauze is not sterile and should not be applied over open wounds. However, it can be applied over a sterile dressing to hold it in place. The gauze is available in varying widths. Selection of the width is based on the body part to be bandaged. Table 10.1 lists tubular gauze widths and body parts each size can be used to bandage. The gauze is applied by means of plastic or metal frame like applicator, which comes in different sizes. The applicator must be larger than the body part to be bandaged to allow the gauze to slide easily over the body part. To assist in selecting the proper gauze width, each applicator is marked with a size that corresponds to the size of the tubular gauze bandage box. Procedure 10.8 outlines the method for applying a tubular gauze bandage to a finger. All right. So ladies, that includes chapter 10. So make sure you read the tables, the figures, the boxes, the terminology. Any questions? All right, very good.